All right, today we're putting on our detective hats and diving deep into the central nervous system. We're going to follow a trail of clues from some really debilitating symptoms all the way to a tiny culprit with a surprisingly huge impact and, ultimately, to a cure.
So here's the central question, the big mystery we're going to unravel today. You've got these symptoms that seem pretty disconnected, right? But as you're about to see, they all point to one very specific cause, something hidden deep inside the brain and spinal cord.
So, let's start where every medical mystery begins, with the patient's experience. What are the first clues? What are the warning signs that tell us something's just not right?
Well, the clues can show up in a lot of ways. The number one sign is a headache, and we're talking a persistent one. But you might also see someone really struggling with their balance. That's called gait ataxia. Or maybe they have a numb or reduced sense of touch, or they're just clumsy, a frustrating lack of coordination. Now, the cool part is, the specific symptoms are a huge clue to the location of the problem. Is it in the cerebellum, our balance control center, the brainstem, running all our vital functions, or the spinal cord, basically our body's information superhighway?
Okay, so with these clues in hand, our medical detectives need a way to actually peek inside the body and find the source. And this is where modern medicine really shines, bringing out its most powerful tools for the investigation.
The absolute gold standard for this kind of detective work is the MRI, the magnetic resonance imaging scan. It is by far the most sensitive and accurate tool for the job. And by injecting a special contrast agent, doctors can literally make the problem area light up, making it stand out in super sharp detail.
And there it is. We've unmasked our primary suspect, a hemangioblastoma. So let's break that down. Benign is great news. It means it's not cancerous. It's a WHO grade 1 tumor, which is the lowest grade. The real key phrase here, though, is highly vascular. That means it is jam-packed with blood vessels, and that's why it shines so brightly on that MRI scan. Take a look. This is exactly what the doctors see. See that small, bright white spot? That's it. That's the hemangioblastoma. It's just a tiny little nodule. But wait a second. If the tumor is that small, how on earth is it causing such massive, debilitating symptoms? Well, that question leads us to a major plot twist in our story. It turns out the tumor often isn't the direct cause of the problem. It's not working alone. In fact, a lot of the time, the tumor is really just the trigger for something much, much bigger. The real source of the patient's suffering is often something else entirely. Get this. In about 80% of cases, these tumors come with an accomplice. It's called a peritumoral cyst. And that's just a fancy way of saying a fluid-filled sac that forms right around the tumor. And this cyst, this is the key to understanding why the symptoms are so severe. So how does this even happen? Okay, think of that highly vascular tumor as a faulty, leaky faucet. It's just constantly dripping plasma fluid from its leaky vessels. This fluid starts seeping into the brain or spinal cord tissue right next to it. At first, it just causes a bit of swelling, but that faucet keeps on dripping. The fluid keeps building up, and eventually the pressure creates an overflowing sink, a huge defined cyst that starts pushing on everything around it. And this slide just shows that process perfectly. Over on the left, you see the early stage. The leaky fluid is causing that initial swelling, or edema. But then look at the right. You can see how that swelling has ballooned into this massive, well-defined cyst. The little tumor is still in there, but now it's totally dwarfed by the very cyst that it created. And here's the kicker, the really crucial point. That cyst can grow to be 4 to 12 times larger than the tumor itself. So now it all makes sense, right? It's not the tiny tumor nodule causing all that trouble. It's the immense pressure from this giant fluid-filled cyst that's wreaking havoc. So we've identified the tumor and its partner in crime, the cyst. The next big question in our investigation is pretty obvious. Where did the tumor even come from in the first place? What's the origin story here?
For most cases, about 2/3 of them, they're sporadic. That just means they seem to appear randomly, with no known cause. But a really significant chunk of them, up to 40%, are linked to an inherited genetic condition. It's called von Hippel-Lindau disease, or just VHL for short. This chart makes the difference really clear. Sporadic cases, you're usually looking at a single tumor that shows up later in life, say in your 40s or 50s. But with VHL disease, patients often get multiple tumors, and they show up about a decade earlier. Plus, it's part of a whole syndrome that can cause other types of tumors throughout the body.
Okay, so we've followed the clues from the symptoms to the diagnosis. We've uncovered the tumor, the cyst, and even a genetic link. So now it's time for the final act.
How do we solve this case and get the patient back to health?
The solution is actually incredibly direct and, well, really elegant. The definitive treatment, the best way to fix this, is to surgically go in and completely remove the tumor nodule. Here's a pre-op image of a tumor in the spinal cord, and you can see it all laid out. There's that small, solid tumor nodule, and then there's the enormous cyst. When it's in the spinal cord, it's called a syrinx, stretching way above and below it. The surgical target is crystal clear.
And this right here, this is the beautiful aha moment of the whole story. This quote reveals the secret. Surgeons don't need to go after that giant, intimidating cyst at all. Nope. By simply removing that one tiny tumor nodule, by just turning off that leaky faucet, the cyst resolves all by itself. The overflowing sink just drains away. It is an absolutely remarkable outcome.
So our medical mystery is solved for today, but you know what? The story isn't over. Not by a long shot. Researchers have actually traced these tumors all the way back to a single, specific type of cell from when we were just embryos. And that discovery opens up this thrilling new question. If we know the exact origin, the literal seed of these tumors, can we develop new, targeted treatments that stop them before they even start, without surgery? The future of medicine is working on that answer right now.